Pnawn da, croeso. Good afternoon and welcome to the annual general meeting of Digital Health and Care Wales. Our AGM today relates to the DHCW report and accounts for the year 2023-24. Just to start, I'd like to note apologies from two of our independent members who happen to be out of the country at the moment, Rowan Gardner and Alistair Class-Neil. We're holding the AGM today virtually, as we do with current practice with all our public meetings, and people are able to follow the meeting live, and a recording of the meeting will be available shortly via links on our website. Simultaneous translation facilities are in place, and you may well need them later in the meeting. If you haven't, not familiar with it, if you hover on your screen with your mouse, you'll see an icon 4 in from the right, which has got interpretation and looks like a globe. If you click on that and select English, you'll then hear the simultaneous translation feed automatically, and the icon will have changed to a white circle with EN in it. Okay. We have a question and answer session planned for at the end of the second half of the meeting after the presentation. We've had a couple of questions in advance. If you wish to ask a question, please do use the question and answer icon again by hovering on the screen. You'll see it. It's the second in from the left. If you do wish to ask a question, it'd be really helpful if you could get those on the Q&A function before the end of the presentations. That would help me considerably when I'm chairing or moderating the question and answer session. If we run out of time, if some questions haven't been asked by the end of the meeting, which is scheduled for 4 p.m., we will answer and publish all questions, and the response will be available on our website within 14 days of this meeting. Great. I'd like to thank all board members, independent members and executive directors and directors who sit as part of the board for their commitment to DHCW over during 2023-2024. The insight they have brought to all discussions has been very useful and essential to the discussions and the decisions that we've made through the year. But of course, we wouldn't be where we are today without the commitment, hard work and dedication of everyone who works for DHCW. So my sincere thanks, both personally and on behalf of the board, to all DHCW staff who have worked through the year and continue to do so into the future. You make a massive contribution to the delivery of quality digital healthcare services for the people of Wales. As everyone will know, the year hasn't been without its challenges. The financial constraints on the NHS in Wales are well known, and we felt that those, just the way everyone else in the NHS delivering services has felt the financial constraints. We've continued to attract and recruit great staff, and that has ensured that we do have the capacity and capability to move into the future, notwithstanding the financial constraints that we are currently under. And I'm really proud of the fact that our digital services have been absolutely key to the safe delivery of care for people right across Wales through the year. So I'm going to hand over to our Chief Executive, Helen Thomas, who will provide a brief overview of our 2023 annual report. Over to you, Helen.
Diolch, Simon. I'm delighted to bring the 23-24 Digital Health and Care Wales annual report and accounts to the AGM today. It reflects our achievements and challenges during the year and a look ahead to this current year. So the DHCW annual report for 23-24 is published as a single unified document, and it can be seen in the AGM papers. But it's also available on our website as a digital interactive report, which includes the performance report, the accountability report, and the financial statements. And I'd urge you to go and have a look at our website to see that. And perhaps you can ignore the video of myself and the chair at the beginning. But so I'd like to remind the board that the annual report and accounts as a whole must be fair, balanced and understandable. And as the accountable officer, I take personal responsibility for this. and the judgments required for determining that it is fair, balanced and understandable. So I'd like to extend my thanks to all colleagues across the organisation for all their hard work this past year, and a special thank you to the staff involved in the delivery of the annual report and accounts. So I will now hand back to our chair to start the DHW showcase and the forward look presentation. Thank you.
Thank you, Helen. Some slides are going to come up shortly, and a number of the executive team directors are going to cover individual slides. So we're going to share the progress of our achievements of 2023-2024 as a statutory organisation. We'll also talk about our finances, our people, our services, and our plans for the future. So Helen is going to introduce the first slide, and I think then seamlessly we'll move between members of the team who will take us through the rest of the slides in the presentation. Over to you, Helen.
Diolch, Simon. And if we move on to the next slide, please. So it gives me great pleasure to introduce the showcase today. So this is a look back at 23-24 and a look forward into 24-25 and the exciting year that we have ahead of us. It's been another year of achievements, I would say, but also challenges, as you referred to in your introduction, Chair. But I'm really pleased with all of the progress that we have been making in our third year of operation as a special health authority. But I'm not going to take up any more time. I'm going to hand over to my colleagues to take us through the showcase, and I think I'm coming back in at the end. So I'm going to hand over to Claire Osmondson-Little, who's our Director of Finance and Deputy Chief Exec.
You're on mute, Claire.
Thank you, Helen. Sorry, I was on mute. Can you move us on to the next slide? Okay, so it's as we know, the financial backdrop from the NHS this year has been challenging, but I'm pleased to report that DHW has achieved all its statutory targets. And what that means, it's achieved its revenue funding within the target level that it was set. And as I will show you later, the total spend for DHW was 165.6 million, which is 307k or 0.2% below its revenue funded cap. And equally, in terms of capital, we spent a total of we were 19k lower than our funding allocation, which is a 0.1% within our funding envelope. In the terms of our annual plan, our secondary financial duty, that was met and approved, and also our annual accounts gave a true and fair view and received an unqualified audit opinion. In terms of our administration targets, these are the public sector pay policy, which requires us to pay our suppliers within 30 days. We achieved 97%, which is 2% above the target that we're required to deliver. And equally, our cash management, we maintained a balance of within 2 million at the year end, and again, achieved the target as set by Welsh Government. So I'll move us on to the next slide. And this slide tries to illustrate our revenue, where our revenue funding comes from and how we spend it. So the dark blue boxes on the left-hand side total 165.9 million. And what that shows is that we have core funding of 110.8 million directly from Welsh Government. And that comes for our core, for our primary care. It also includes our depreciation. It includes our DPIF allocation, and also includes our COVID allocations. We also receive funding from the NHS in Wales through the SLA, so that's our service level arrangements, Microsoft, and supporting the primary care laptops. That totals 53.8 million for the year. We have other income, small levels of income from NHS Wales, and a very small amount from Northern Ireland, which means our total income was 165.9 million. And we then spent that money primarily on operational services. And to give you an idea of what that 96 million is made up of, That includes all our Microsoft licenses. It includes our data centers and our ICT and our development costs, together with our program teams, our clinical libraries, and the primary care and mental health support. Further to that, we've got primary care funding of 17.3. We have depreciation, and that's of 9.9, and facilities of 1.8. We then invest in digital developments through the Digital Priorities Investment Fund. That totals 33.7 million, the box in purple. And finally, we maintained and supported our vaccine and our track and trace systems, which are the ones in yellow, and total 6.8 million for the year. So overall, we were 0.3 million underspent, and you can see from this where our funding came from and where we allocated it. So I'm going to hand over next to my colleague. Next slide. To SJ.
Thank you, Claire. Thank you very much. Yes, it's been quite a busy and challenging year. So I've just tried to take a few of the highlights from shaping our workforce and all the component parts within that, really. So I'll start with leadership. We've had a really great year, and I think we talked through this in very high level terms earlier in the board meeting. But we've got leadership and development and talent opportunities now for everybody. So we've went through the King's Fund leadership programme for the 8 season above, and that was really well received. And as Helen said earlier at the board, that will be continuing as an in-house provision to move that forward and to progress that for this year. We've worked with Silver Maple to look at the talent cohort and work through various things with the talent cohort, the band 6s to 8Bs. And we launched and delivered the 3s to 5, the emerging talent, which was great. And that was an in-house joint effort. And a big thanks to colleagues in the room, especially to Sam Hall, who helped deliver some of those modules. And that was really well received as well. I think in terms of a great organisation to work, we've had a number of acknowledgements from the British Computer Society in terms of our external accreditation and nominations, and winning various different accolades, but also through our staff awards and recognition and feedback. It's been a very sort of positive space to operate in. In terms of strategic workforce planning, we've worked really closely with Gartner to look at best practice modelling and made it a little bit more strategic this year. I think we mentioned last year that it was quite operational. We've done an upskilling of the managers. We've worked with some brilliant directorate managers out in the organisation. So it's been a really good joint enterprise, and everyone's made a significant push on that. So that's been great, and it's really enabled us to showcase where we are with our skills gaps and what we need to go after. In terms of new ways of working, there's a new programme of work, and I think Claire will talk about that a little bit later in this presentation, in terms of building our future, the cloud strategy, moving to product approach. But we've also done other things, the new health and wellbeing policy, but indeed working in partnership with the trade unions to support the hybrid working policy, which was great. And finally, the wellbeing and engagement piece, and the equality, diversity, inclusion. Big thanks to volunteers throughout the organisation who sit on both the health and wellbeing group and the equality, inclusion and diversity network. It's been really welcomed and very active and really supportive, developing a number of initiatives and deliverables for everyone that works in the organisation, but also through independent, international and British standards accreditation and acknowledgement through the ISO 3415 and the BS 76000, and also receiving the highly commended awards at the HPMA for EDI as well, which was brilliant. So lots in that space, really. So yeah, hopefully more to come. So thank you. And I shall now pass over to my colleague, Ifan Evans.
Diolch yn fawr, SJ. Os allwn ni gael y sleid nesaf, ond wrth bod ni'n symud, mae'n bleser mawr I gael y cyfle I edrych nôl ar y cyflawniad y sefydliad dros y flwyddyn diwetha. Wy'n ddiolchgar tu hwnt i'r tîmoedd ar draws y sefydliad I gyd, a wi jyst eisiau dweud faint o bleser yw I weithio yn y sefydliad a gweithio gyda'r pobl yn y tîmoedd yna yn bob un o'r cyfarwyddiaethau. Mae'n lle ardderchog I weithio. Ond fedrwn ni ddim wneud dim byd ar ein pen ein hunain, a mae partneriaeth yn rhan hollol greiddiol I sut mae'r NHS a'r sector gyhoeddus yn gweithio yng Nghymru, a mae gyda ni lawer iawn o randdeiliad ac o bartneriaid. Dwi'n mynd I fynd trwy bob un ar y blwch fan hyn, dwi'n mynd I tynnu rhai ohonyn nhw mas, ond jyst I ddweud, yn ystod y flwyddyn diwethaf, mae'r bwrdd wedi cymryd diddordeb mawr yn ein strategaeth a'n cynllun I weithio gyda'r rhanddeiliad ac yn parhau I wneud hynny ac ar hyn o bryd ni jyst yn gorffen rhywfaint o waith dadansoddi ar yr adborth I ni wedi cael oddi wrth yn rhanddeiliad achos I ni'n hollol ymrwymiedig I ddangos pa mor bwysig yw hynna I ni ac I fod yn dryloyw ac yn agored o ran adrodd ar natur y berthynas mwyn buddsoddi ynddo fe, mwyn I wella fe. Fel wedais I, dwi'n mynd I sôn am bob rhanddeiliad, ond mae Llywodraeth Cymru yn amlwg yn bwysig iawn I ni, nhw sydd yn ariannu rhan helaeth o'r sefydliad, a hefyd nhw sy'n gosod cyfeiriad polisi cenedlaethol ar gyfer digidol ac ar gyfer iechyd. Felly, ni'n gweithio'n agos gyda nhw, mae fe'n rhan o'n dyletswydd statudol ni roi cyngor ar ddigidol i'r Llywodraeth, a ni'n ceisio gwneud hynny, a ni'n gweithio yn agos gyda'r weithrediaeth Gwasanaeth Iechyd Genedlaethol hefyd. Yn ail, dydy ni ddim yn darparu'n uniongyrchol yn gyffredinol I gleifion heblaw yn yr ap. Byddwn ni'n sôn am hwnna nes ymlaen. I ni'n gweithio trwy sefydliadau eraill yn yr NHS, partneriad fel contractwyr gofal sylfaenol ac yn arbennig y staff, degau o filoedd o staff sydd yn defnyddio y gwasanaethau digidol I ni'n darparu. Maen nhw'n bwysig tu hwnt I ni a ni'n buddsoddi yn y gwaith yna mwyn sicrhau bod ni'n darparu yr offer a'r gwasanaethau maen nhw'n ffindio'n ddefnyddiol. A wedyn, yn drydydd, wi jyst eisiau galw allan y cyflenwyr I ni'n dibynnu ar. Mae llawer o'n systemau ni'n gyfrifol am nifer o systemau sydd wedi darparu gan gyflenwyr. A ni hefyd yn gweithio'n agos gyda NHS Lloegr, enghraifft, a gyda'r eraill, a mae yna natur cyflenwr i'r gwasanaeth hynny. I'n ddibynnol iawn arnyn nhw am rhai o'n gwasanaethau allweddol, felly I ni'n buddsoddi'n drwm yn y berthynas yna mwyn sicrhau bod e'n fwy na just contract, bod e'n berthynas sydd yn agosach at bartneriaeth, fel bod ni'n deall I anghenion nhw a bod nhw'n deall yn anghenion ni. Felly, just I gau ar hwn, pwysleisio mor bwysig yw yn rhanddeiliad a'n partneriaid I ni. Os allwn ni fynd i'r slaid nesaf, mae yna un arall gen I cyn trosglwyddo. So, I ni'n symud nawr mewn i'r 5 cenhadaeth sydd gyda ni. Mae'r 5 cenhadaeth yn ein strategaeth, yn ein cynllun tymor canolig, yn ein adroddiad blynyddol, yn ein cynllun blynyddol ac yn y blaen. Felly maen nhw'n holl bwysig I ni o ran sut I ni'n strwythuro'n gwaith a'n strategaeth a phobeth arall. Mae yna gryn dipyn o gyflawniad wedi bod yn y flwyddyn ddiwethaf, 24-25, a wi jyst eisiau rhoi blas ar hynny yn gyflym o ran y gwaith I ni wedi bod yn gwneud yn buddsoddi yn ein canolfannau data, oedd yna adroddiad yn y cyfarfod y bwrdd bore yma, a sut I ni wedi cwblhau y broses hynny, a mae hwnna yn dilynglod i'r tîmoedd yna. A wedyn o ran y gwasanaethau cleiant, I ni'n darparu ar draws ein sefydliad ni'n hunain, ond hefyd gofal cychwynnol a rhai gwasanaethau eraill a carchardai ac yn y blaen. Mae yna ni 16,000 o ddefnyddwyr a mwy na hynny o ddyfeisiau. Felly mae yna lot fawr o waith yn digwydd ar draws Cymru I gyd, a mae'r gwaith hynny wi'n gwybod yn cael ei wneud yn broffesiynol tu hwnt. Wedyn, o ran diogelwch, mi fydd bobl sydd wedi bod yn claddu sylw i'r newyddion, wedi clywed am nifer o ymosodiadau seibr yn ddiweddar. Mae hwn yn waith parhaus bob dydd I ni a'n partneriaid yn arbennig y byrddau iechyd I wneud ein systemau mor ddiogel a phosib a cadw nhw yn ddiogel trwy'r amser, achos mae yna fygythiadau o bob cyfeiriad, miloedd ar filoedd o fygythiadau bob dydd, a mae'n rhaid I ni fod yn gwarchod trwy'r amser, a mae'n waith pwysig iawn yn digwydd fyna. A wedyn, o ran yr adnodd data cenedlaethol, rhaglen hynod o bwysig, a llynedd yn garreg milltir i'r rhaglen, bod e'n mynd yn fyw fel platform, neu fel llwyfan am y tro cyntaf ym mis Awst. A mae'n bleser mawr I weld hynna'n digwydd, o wy'n falch iawn o beth sydd wedi cael ei gyflawni. A I ni nawr yn dechrau dod â gwasanaethau data yn fyw ar y platform hynny, yn cychwyn gyda gwasanaethau terminoleg a gwasanaethau creiddiol o'r fath. A wedyn yn olaf, ni'n ymwybodol tu hwnt yn y sefydliad bod ni yn gyfrifol am ddata sydd yn gallu bod yn bersonol ac yn breifat tu hwnt, a bod e'n holl bwysig bod ni'n gallu gwarchod y data hynna a'i defnyddio fe'n gyfrifol ac yn ddiogel a cadw cofnod o sut rydyn ni'n defnyddio fe. A ni yn gweithio i raddau fel canolfan o ragoriaeth ar draws NHS Cymru ac yn gweithio yn agos iawn gyda swyddfa'r Comisiynydd Gwybodaeth a gydag eraill. Mae yna waith da a pwysig iawn wedi cael ei wneud y llynedd yn fyna. Wi nawr yn trosglwyddo i Sam Lloyd ar gyfer y genhadaeth nesaf. Sam.
Thank you, Ivan. I'm Sam Lloyd, Exec Director of Operations, and I'm going to talk about Mission 2. So if we could move the slides on, please. So Mission 2 is about delivering high-quality digital products and services. This covers major clinical areas and care settings across primary and secondary care, including the major national products that we deliver on behalf of NHS Wales. This is about us helping to deliver person-centred care and supporting the transfer of care between different settings and across boundaries as simply, effectively and safely as possible. There are a large number of services in this portfolio, so I'm going to touch first on our overall service availability and then pick out some of the highlights that we've delivered in the last financial year. So looking at our availability overall, we take very seriously the fact that healthcare professionals rely on the services that we provide. And at 99.984%, our availability this year was above target, and this reflects our ongoing investment in the stability of our services. Like any technology service, we do experience major incidents, and we had 44 in this period. 98% of those were resolved within our target fixed times, and we always conduct reviews of major incidents to capture the lessons learned. And our availability over time is gradually improving, which does reflect the investment that we're continuing to make. So moving on to the digital medicines portfolio. So this combines projects that will deliver benefits of a fully digital prescribing approach in all care settings in Wales. So that includes e-prescribing in primary care and secondary care. It includes the establishment of the shared meds record, which is to help provide a common view of medicines and prescribing information across different systems and settings, so to help clinical decision making. And it's also about giving patient access to medicines information in the app. We launched the first electronic prescription service in November, and the Minister for Health and Social Care visited some test sites to mark that occasion. And since then, thousands of prescriptions and prescription items have been sent using the service. So moving on to primary care. So we provide primary care with a growing range of digital tools to help GPs manage records, organise their daily tasks and care for patients. And further to the establishment of the Primary Community and Mental Health Directorate at the end of last year, we've developed our primary care strategy. This was published in Q2 and aims to provide DHCW with a platform from which we can deliver digital products and services with improved value and benefits. It hinges on 4 principles of delivering quality, informing policy, building value, and guiding and standardising the use of data and information. So moving now on to our vaccines programme. So the Welsh immunisation system is at the heart of the COVID-19 vaccination programme in Wales. It also supports the administration of seasonal flu vaccines alongside COVID or at walk-in flu clinics. GP patient records are automatically updated with vaccine or vaccination information from this system. And the system is used across all health boards with nearly 14,000 users in vaccination settings, over 8,000 in general practice, and 352 in pharmacies. And we recently supported the 10 millionth COVID vaccination in Wales. So the diagnostics programme, we're working to integrate new laboratory and radiology informatics solutions, expand electronic test requesting functionality, and enhance the national availability of diagnostic results and reports. This means better access to test results, improving patient care and clinical safety. Better information sharing across boundaries and the improved storage and distribution of imaging are also key goals. In the previous financial year, we enabled 40 million laboratory tests to be managed, and also the creation of 2.8 million radiology requests. And so I'm going to hand back at this point to Ivan Evans. Thank you.
Diolch Sam. Os allai gael y sleid nesaf, ni'n symud I cenhadaeth 3, a mae hon yn cenhadaeth gyffrous iawn. Jyst dim ots pa mor gryf yw'n is-adeiledd a'n platfform, jyst dim ots pa mor dda yw ein gwasanaethau digidol, os nag yw defnyddwyr yn defnyddio nhw, wel, does na ddim llawer o wahaniaeth yn mynd i ddigwydd o ran cleifion. Beth i ni'n neud yw darparu offer a gwasanaethau sydd yn ddefnyddiol a cadw data a wedyn cyflwyno hwnna'n nôl fel gwybodaeth mwyn helpu bobl i gwneud eu gwaith a gwneud eu gwaith nhw'n fwy hwylus. Mae'n bwysig iawn i ni yn dod nôl i'r thema ynglyn â rhanddeiliad a gweithio gyda a trwy partneriad. Felly dyna welwch chi ar y sleid yma. Gwaith gyntaf ynglyn â UCD neu User-Centered Design, fel bod ni'n rhoi mwy o bwyslais ar hynny, gweithio'n agos iawn gyda'n defnyddwyr, ddeall beth sydd angen arnyn nhw a darparu iddyn nhw yr offer sydd yn gwneud eu gwaith nhw'n well a helpu nhw i weithio yn well wrth eu gwaith. Mae hwnna'n bwysig a gynyddol bwysig i ni. Canolfan ragoriaeth arall, Microsoft 365. Mae yna fuddsoddiad enfawr yn Microsoft 365 fel gwasanaeth ar draws yr NHS yng Nghymru. Ni sydd yn darparu'r denantiaeth ar gyfer bob corff iechyd, dros 100,000 o ddefnyddwyr. Swm sylweddol iawn yn cael ei wario, a pwrpas y ganolfan ragoriaeth yw cael y gwerth gorau posib allan o'r buddsoddiad sylweddol yna yn flynyddol yn gweithio yn agos iawn gyda byrdde iechyd ac ymddiriedolaethau iechyd ac eraill. Un o fy ffefrynnau, a mae yna gwestiwn gyda ni nes ymlaen ar yr app, sef app Gwasanaeth Iechyd Genedlaethol Cymru. 24-25 yn flwyddyn hynod o bwysig, 23-24 yn flwyddyn hynod iawn o bwysig. Lancio'r app fel beta cyhoeddus ym mis Ebrill 2023, ac erbyn diwedd y flwyddyn, mis Mawrth eleni, wedi cysylltu pob practis meddyg teulu yng Nghymru a gyda yn agos i 180 o filoedd o ddefnyddwyr, dwi'n meddwl. I ni erbyn hyn, ym mis Gorffennaf, lan i 240 o filoedd o ddefnyddwyr ar yr app. Mae hwnna'n gynnydd sylweddol iawn am yr app yn ffenest siop i ni ac yn wasanaeth hynod o bwysig ar maes lle i ni'n cael cysylltiad mwyaf uniongyrchol gyda'r cyhoedd a gyda'r cleifion. Mae yna waith arall, calon ein gwaith yw gweithio gyda staff a darparu systemau digidol i staff mewn ysbytau fel arfer, ond mewn gwasanaeth gofal cychwynnol hefyd. A mae 3 gwasanaeth nesaf yn enghreifftiau o hynny, sef y gwasanaeth cancer, a'r cofnod gofal nyrsio, a'r porth clinigol Cymru. Mae yna 10 o filoedd o ddefnyddwyr bob dydd nawr o'r foment hon o'r gwasanaethau hynny ar draws yr NHS yng Nghymru. Maen nhw'n holl bwysig i ddarparu gofal diogel o ansawdd uchel ar draws Cymru. Maen nhw'n bwysig iawn i ni a ni'n parhau i fuddsoddi yn gwella y systemau hynny. A wedyn yn olaf, i ni hefyd yn darparu gwasanaethau e-lyfrgell eto ar draws Cymru gyfan, fel bod staff yn medru cael gafel ar y wybodaeth sydd yn berthnasol ac yn amserol, a gyda dystiolaeth sydd angen arnyn nhw i wneud penderfyniadau clinigol o safon uchel. Felly, be welwch chi yn yr genhadaeth yma yw nifer o wasanaethau a cynnydd sylweddol yn ystod y flwyddyn diwethaf yr app yn arbennig, ond ar draws pob maes. A wy'n credu mae'r peth wys y tynnu fwyaf sylw at yw y buddsoddiad neu'r cynnydd yn ein buddsoddiad ni yn gweithio yn uniongyrchol gyda defnyddwyr mwyn bod ni'n gallu darparu'r offer gorau posib iddyn nhw yn eu gwaith. A wi nawr yn trosglwyddo i Rhydian Hurl.
Good afternoon. Thank you, Evan. My name is Rhydian Hurl. I'm the Medical Director here at Digital Healthcare Wales, and I lead on the strategic objective number 4, which, if we have the next slide, shows you that we're here to drive better values and outcomes through innovation. In the annual report on page 50, you'll see details about the research and innovation portfolio and links to the first annual report relating to that. We've been working in partnership with a number of key stakeholders, including the likes of the Bevan Commission, Blood Cancer UK, Welsh universities and others. And we've delivered the objective of find, recruit and retain. So this is the outline plans for the ability for patients to enroll within clinical trials. And we know that patients who enroll in clinical trials tend to have better outcomes. And the other part of this is value from the data. And again, you'll see in the report on page 51, the information analytics strategy. Some good progress has been made with the Welsh Health Intelligence Portal, the General Medical Practice Escalation Tool, and a number of other tools. You can see on from the Health Intelligence team online, you can see some dashboards which show statistics of performance around Wales, both in primary and secondary care. And we provide a number of dashboards that allow clinicians and leaders across Wales to consume data in an easy to use, common format, so that we can help service improvement and learning. And I think now I have to hand over to Claire.
Thank you, Rydian. Diolch, Rydian. We now go to the final mission of DHEW, which is all about being that trusted partner that produces high quality, inclusive and ambitious organisations. So if we move on to the next slide. And what the makeup of that mission really encompasses all the enabling factors to make DHEW a successful organisation. Most importantly is the people and our values and culture that really underpins the organisation, supported by the finance teams that really focus on sustainability, but also on the benefits and value that we create. Sustainability has many factors, and it includes our commitment to the social economic aspects of the foundational economy, but also improving our decarbonisation and biodiversity. And we do that through engaging with our broad range of stakeholders. And at the centre of all of that is ensuring that we are a quality organisation and we embed the dynamics of quality in our thinking and in what we do. We have strong governance and assurance process, and we aspire to the highest standards. And we also lead the way in contractual services across NHS Wales with a digital edge towards them. So I'm now going to hand over to my next colleague, which is about looking forward. So I'll hand over to Helen, I think.
Yeah, Ivan next. If you move on to the next slide,
sorry.
Ivan. That's okay.
Sorry.
Dim problem. Diolch Helen, diolch Claire. Dylwn ni fod wedi cyflwyno'n hun, fel mae pawb arall wedi gwneud. Ifan Evans ydw i, cyfarwyddwr strategaeth. A felly, rwy'n treulio fy holl amser yn sychu tuag at yr ffurfafen yn meddwl beth sydd yn dod nesaf yn y dyfodol. Wel, ddim cweit. Ond mae hwnna'n beth pwysig iawn i ni. Tra bod ni wedi cyflawni lot yn y flwyddyn diwetha, a tra bod eleni yn bwysig i ni, a tra bod tîmoedd ar draws y sefydliad yn brysur tu hwnt bob dydd yn darparu gwasanaethau sydd yn ddiogel a sydd yn cael eu defnyddio gan ddegau o filoedd o bobl ar draws NHS Cymru, mae rhaid i ni gynllunio ymlaen. A mae'r maes digidol yn newid yn gyflym iawn. A mae rhaid i ni feddwl am sut i ni'n mynd i gamu tuag at y dyfodol a beth i ni'n gwneud. Os allwn ni fynd i'r sleid nesaf, please. So i'r rheini ohonoch chi sydd yn gwylio'r adroddiad, y ffordd i gael y manylion yw i fynd i wefan DHEW ac i edrych ar y strategaeth hir dymor, sef yn strategaeth ni tan 2030, cyfnod o 6 mlynedd, ac i edrych ar yr IMTP, sef y cynllun cyflawni manwl dros y 2 mlynedd nesaf, sydd yn dangos sut i ni'n mynd i gyrraedd, wel o leia hanner cyntaf y siwrne hynna. A mae'r dogfennau hynny yn cynnwys y 5 cenhadaeth. Allwch chi weld ar y ochr chwith y sgrin o'ch blaenau chi nawr. Maen nhw'n gyson trwy bopeth i ni'n gwneud dros 6 mlynedd, dros 2 mlynedd, dros 1 blynedd, fel bod ni'n gallu sicrhau bod ni'n parhau yn mynd yn y cyfeiriad dylwn ni fod yn mynd fel sefydliad. Ond mae lle i wella, a mae'n wastad lle i wella. Mae fe'n rhan o ddiwylliant digidol, continuous improvement, iterative development, a i ni eisiau felly gwella rhai o'r pethau a rhai o'r dulliau gweithio sydd gyda ni a'r 5 egwyddor sydd lawr ochr dde y sgrin, welwch chi ar hyn o bryd, yw rhai o'r pethau ni'n mynd i ddefnyddio mwyn profi'n hunain. Bob tro ni'n gwneud penderfyniad, bob tro ni'n ystyried beth yw flaenoriaethu, a mae'n rhaid i ni flaenoriaethu drwy'r amser. Bob tro i ni'n ystyried ac yn cynllunio, ni'n gofyn y cwestiynau hyn i'n hunain, a ni'n gofyn ein timoedd ofyn y cwestiynau yma i'w hunain hefyd, mwyn bod ni'n gallu gwella y ffordd i ni'n gwneud penderfyniadau a cael y gwerth mwyaf posib allan o beth i ni'n gwneud. Just yn gryno iawn, mae pobl mor bwysig i ni rhanddeiliad, ein staff ni'n hunain, defnyddwyr ein offer digidol, dyna yw ein prif flaenoriaeth yw bod ni'n meddwl am y bobl sy'n defnyddio'n gwasanaethau. Mae yna gryn dipyn o gymlethdod yn beth i ni'n gwneud. Mae cymlethdod ac amrywiaeth yn creu gwaith ychwanegol, felly rydyn ni eisiau symleiddio y ffordd i ni'n gweithio a'r ffordd mae'n systemau ni yn gweithio i ddefnyddwyr. I ni'n gwybod bydd na fwy o ddata, mwy o ddigidol mewn 5 mlynedd, a bydd mwy fyth mewn 10 mlynedd. Dim ond un ffordd mae'r maes digidol yn mynd, sef mynd yn fwy ac yn fwy pwysig. Felly mae rhaid i ni gynllunio am hynny, mae rhaid i ni ystyried sut gallen systemau a'n platfformau a'n is-adeiledd handlo yr her yna sydd o'n blaenau. A wrth bod ni'n gwneud hynny, mae rhaid i ni chwilio am werth ychwanegol yn pob beth i ni'n gwneud. Mae hwnna'n bod yn fwy cynhyrchiol, ond mae hefyd yn defnyddio technoleg newydd fel deallusrwydd artiffisial, a mae fe ynglyn â sicrhau bod gwerth y buddsoddiad sylweddol mewn technoleg digidol yn cael ei wireddu ar draws yr NHS. A wedyn yn olaf, mae'n rhaid i ni dysgu o'r gorffennol a symud ymlaen o'r gorffennol mewn i'r dyfodol. Os ewch chi i'r sleid nesaf, mae well gen i'r cyfeithiad dysgu o ddoe, camu at yfori. Mae digidol fel dwedes i yn symud yn gyflym iawn, a mae'n gost o aros yn rhy hir ar technoleg hanesyddol sydd yn mynd yn fwy drud ac yn fwy bregus hefyd. Mae'n bwysig tu hwnt bod ni yn parhau i symud ymlaen a defnyddio y technoleg fwyaf modern sydd gyda ni. Felly, just cipolwg yw hyn ar pa mor bwysig yw ein gweledigaeth strategol i ni. Mae'r manylion, fel wedes i, yn y dogfen strategol ac yn yr IMTP. Mae'r ddau ohonyn nhw'n ddogfennau gymharol gryno a gwerth i darllen. Byddwn ni'n argymell iawn yn fawr bod chi'n gwneud hynny. A gyda hynna, dwi'n trosglwyddo yn ôl i Helen.
Diolch, Ifan. And if we can move on to the next slide, please. So in order to achieve the ambitions, as Ivan's just set out, that we've set ourselves in our long-term strategy as an organisation and achieve the mission that Claire set out in being that trusted strategic partner, a high quality, inclusive and ambitious organisation, we acknowledge that we need to change and we need to change the way we work as an organisation. So that's why we are this year setting up a transformation programme, the Building Our Future programme, which Claire is leading for us as part of the executive team. And this will oversee kind of how we are going to bring the principles that Ivan has just talked us through in our strategy to life. So how are we going to ensure that we are putting people first and that we are actually ensuring that we are supporting our teams to be the best that they can be and give them the development and opportunities that they deserve, and we become that dynamic organisation and the best place to work and maintain being the best place to work, and ensuring that we are simplifying all that we do and standardising, designing again for the future, with the certainty that we will have more data and more digital, that we need to ensure that we are ready and set up to embrace that and find the value. It's not just drive value. This is about finding more value and how do we sustain and improve and become more efficient and find the value, not just for us as an organisation, but importantly for the wider NHS. And as Ivan pointed out, that embracing the future there, that is about how do we modernize our services and our systems, and embrace how do we kind of ensure that all of that is designed in to take us forward. So hopefully what you've heard from us this afternoon demonstrates how Digital Health and Care Wales is making digital a force for good. So on that note, Chair, I think that I will hand back to you.
Thank you, Helen and team. Obviously, that run through or counter through has given you everyone a really good overview of the sheer range of things that are going on across the organisation, and also I think very helpfully a very coherent way that's been expressed through those 5 missions. Okay, so question and answer session. We've had a couple of questions presented in advance, none as of yet in today's Q&A function on the Zoom call, but if any do come through, I'll keep an eye out for that. But the first question I think probably is one for you to pick up initially, Sam Lloyd, and that's what are the biggest external threats from a cyber perspective, taking into account some of the recent cyber attacks elsewhere?
Yeah, thank you, Chair. This is a really important question. We do live in a world of increasing cyber threat, unfortunately, and one only has to look at the news to see that the prevalence and severity of cyber attacks, particularly against the health sector, is growing, and that's a very worrying trend. We recently saw an attack against the pathology supplier to several London hospitals, and that led to appointments and operations being cancelled and sensitive patient information being published on the dark web. So these attacks are causing real harm. That was a ransomware attack, and by ransomware I mean an attack where cyber criminals are able to infiltrate a network and encrypt the data that's held by an organization, so that data becomes inaccessible to that organization, and only those criminals have the key, and they therefore ransom that data back to you by giving you the key when you pay for it. This, I think, is the biggest threat to health at the moment from a cyber perspective. It is really damaging. It takes a long time to recover, and it causes a lot of harm and distress. What we're also seeing, which is closely related to the ransomware threat, is the increasing professionalization of cyber crime. So you can actually buy ransomware as a service from service providers who will happily sell it to you and conduct an attack on your behalf. You can also buy lists of vulnerabilities from other providers, and you can combine those into a very damaging attack. So it's becoming possible for people who really are quite, have limited technical knowledge to actually mount quite sophisticated attacks. We saw last week the CrowdStrike issue, which wasn't a cyber attack, but it does serve to illustrate, I think, the extent of the interconnectedness of systems across the across the world, but particularly across the health system, which I think is an illustration of the supply chain dependencies that we have. We're dependent on suppliers, we're dependent on partners. There are a lot of complicated relationships which are quite difficult to kind of map out and understand, and therefore to understand and be able to anticipate the extent of an attack on any part of that system. And then lastly, AI is both a threat and an opportunity. It can be used to defend against cyber attacks, but it can also be used to really develop quite advanced cybersecurity attacks on the fly and circumvent organizations' defenses. And we're also seeing AI being used in social engineering. So the tech that enables chatbots and things to be, to appear as quite convincing from a human interrelation perspective can also be used to undertake social engineering attacks and convince you that you're talking to something which is genuine, and therefore it makes it easier to entice people to part with their credentials and so on. So we're seeing AI used in phishing campaigns and so on. So I think that's just a flavour of the threat landscape. It is something that we're taking very, very seriously.
Thank you, Sam. I had another technical glitch while you were talking there, I'm afraid. I think too, I wanted to add that, though obviously the perpetrators of cybercrime see it very much as an issue of financial gain, and indeed the consequences of any form of cyber attack in terms of putting things right have huge financial consequences for whichever organization is attacked. And you pointed out yourself in terms of operations cancelled and other clinical issues, and it's really important that we see cyber attacks in the context of patient safety and citizen welfare, because it might cost money to put right, but whilst has gone wrong, there's significant potential harm and risk to patients, which is easily lost, I think, when the big money figures are talked about. Anyone else want to add anything on the cyber before I move on to the next question? Okay, the next question was submitted in Welsh, and I think it's only courteous that the question is asked in Welsh, and I'm going to ask Ivan to do that, but also it's a question that very much falls into his area of responsibility, and ask him to follow up asking the question by answering the question. So over to you, Ivan.
Diolch yn fawr, Cadeirydd. Felly, wy'n mynd I ddatgan y cwestiwn yn gyntaf a wedyn ateb. Felly, y cwestiwn oedd, mae app Gig Cymru yn ddatblygiad cyffroes I bobl Cymru, gael mynediad at wybodaeth ddefnyddiol, trefnu apwdiadau ac archebu presgripsiynau. Fodd bynnag, mae'n ymddangos bod gwahaniaeth rhwng yr ystod mynediad ledled Cymru ar hyn o bryd. Enghraifft, nid yw fy meddygfa wedi cofrestru eto, fodd bynnag gallaf archebu presgripsiynau, sy'n wych gyda llaw. Pryd I chi'n rhagweld y bydd hyn yn cael ei ddatrys fel bod mynediad teg ar draws Cymru gyfan. Felly, diolch yn fawr iawn am y cwestiwn, a wy'n falch bod yna bethau sydd yn wych yn yr app yn amlwg, a mae'r defnydd o'r dull archebu presgripsiynau yn cynyddu yn weddol gyflym a lan I tua 70,000 y mis, wy'n meddwl, o presgripsiynau ar hyn o bryd. A mae bob meddygfa teulu yng Nghymru wedi cysylltu ar app, ond mae beth maen nhw wedi galluogi yn yr app yn amrywio o un practis i'r llall. Mae yna nifer o resymau am hynny. Mae bob practis yn gweithio'n annibynnol, a maen nhw'n gweithio mewn ffyrdd gwahanol, a maen nhw'n trefnu I cyswllt gyda cleifion mewn ffyrdd gwahanol, a I ni wedi parchu hynny wrth I ni gysylltu practisau am y tro cyntaf. Ac ar ben hynny, fel byddwch chi wedi gweld, os ych chi'n edrych ar y newyddion a clywed am beth sydd yn ymlaen yn y system iechyd yn gyffredinol, mae'r proffesiwn yn un sydd dan bwysau sylweddol iawn ar hyn o bryd, oherwydd pwysau gwaith a bobl yn ymddeol ac yn y blaen. A mae'r nifer o bractisau yng Nghymru wedi gostwng yn sylweddol dros y blynyddoedd diwethaf o dros 400 I tua 371, 373 neu rhywbeth tebyg ar hyn o bryd. Felly mae'n broffesiwn at ei gilydd sydd dan bwysau sylweddol. Felly mae troi popeth ymlaen I gyd ar yr un pryd yn syth yn rhywbeth sydd yn gyntaf yn mynd I peri cryn dipyn o gynsyrn, ond hefyd o bosib pwysau mewn practisau, nad yw'r practisau hynny wedi cael cyfle I baratoi ar ei gyfer. Felly, dyn ni'n gweithio'n galed iawn I helpu bob practis I ddeall, a ni'n gweithio'n agos iawn gyda'r practisau a gyda tîm gofal cychwynnol Sam Hall, ond hefyd gyda'r Llywodraeth ar y sefyllfa bolisi ac ar y negodi blynyddol ar y contract ar gyfer meddygon teulu, mwyn bod ni'n gallu gwneud hyn mewn cydweithrediad â'r proffesiwn a gwneud hyn mewn ffordd synhwyrol ar draws Cymru I gyd. A nid DHCW ar ei ben ei hun sy'n penderfynu pryd I droi pethau ymlaen, fel bob un o'n rhaglenni cenedlaethol. Mae hon yn rhaglen gydweithredol, lle mae gyda ni randdeiliad a phartneriad, a ni'n gweithio'n agos iawn gyda nhw mwyn sicrhau bod ni'n cael y sefyllfa gorau a'r balans mwyaf priodol ar draws pob peth. Felly, does gen I ddim dyddiad yn anffodus, allai weid yn sicr, mae dim ond un ffordd mae'r traffig yn mynd, sef mwy o nodweddion yn cael ei troi ymlaen yn yr app, a hefyd mwy o ddefnyddwyr yn defnyddio'r app a mwy o wasanaethau ar gael. A ni'n parhau weithio yn agos iawn gyda'r Llywodraeth a gyda'r proffesiwn mwyn ceisio cael darpariaeth sydd yn gyson ar draws Cymru I gyd. A bydden ni'n anelu bod hwnnw gyda ni rhywbryd yn ystod y flwyddyn nesaf, ond fedrai ddim rhoi addewid nac amserlen pendant achos mae'n dibynol ar sawl ffactor gwahanol. A mae'r berthynas agos o gydweithredu hynna a cydweithio yn bwysig iawn iawn i ni fel sefydliad ac yn wir i'r gwasanaeth iechyd at ei gilydd. Felly dyna pam i ni'n mynd o'i chwmpas i yn y ffordd rydyn ni'n gwneud.
Diolch, Ifan. I'm in the same situation as the questioner in that I can order a prescription and that's all I can do. And I think it is worth emphasising, and you did there, Ifan, that it's not ourselves who can't set a date or won't set a date. It's very much in the gift of others to for some things to happen to enable us to move forward at the pace that everyone hopes we'll be able to move forward at. What I do know is that as we get beyond the full functionality that's already available, the opportunities the app offers for people accessing information about their own personal healthcare or managing their own health and well-being is, I would hesitate to say limitless, but it is certainly huge. And I very much hope as we move forward that the resources will be there for us to really get the app supporting people's citizens of Wales' health and well-being and managing their own healthcare and healthcare pathways. Let me just check. I don't think there have been any further questions asked, which there haven't. Helen, I don't know if you want to say anything before I wrap up the AGM, but by all means do.
I just want to pass on my thanks again, really, to the organisation and all of the hard work that's gone on this year, and to thank my team and the board for all of the support that we've had. Hopefully, that's been a good kind of overview of the annual report and accounts for this year. Thank you.
Thank you, Helen, and I'd echo that sentiment to thank, repeat again, thank the board for your diligence and work throughout the year, to thank all the staff of DHCW, those who were with us before the start of the year and those who've joined us through the year. Without you, of course, we couldn't have achieved all the things we have achieved. And to all those we work with outside the organisation, I very much hope that we continue to do that in a constructive manner and in ever closer ties, because without working in partnership, we, as has been referenced in the previous answer, we won't be able to achieve the significant and the medical director would never forgive me if I didn't say this, the significant digital benefits to patient safety and patient care, which is what digital is all about. So thank you all very much. It was a great year. As they say, onwards and upwards. Thank you.